So I still, Loloestrin.
I was just about to say that's my favorite.
Yeah. So I use Loloestrin a lot. Loloestrin is Norethindrone progestin. The reason why I like Norethindrone is it's a little bit more androgenic. The more androgenic the progestin, it has the ability to blunt or mitigate the increase in sex hormone binding globulin. Again, I'm talking about pills from a sexual health perspective. There's lots of other ways you could view this, but today this is my angle. And so when you think about super low dose ethinyl estradiol, low side effects, plus a slightly more androgenic progestin, you then can have a blunting of the increase in sex hormone binding globulin. It's less likely to gobble up all those extra androgens, and patients tolerate it really well. Side effects are there's more bleeding because of the low ethinyl estradiol. So sometimes I'll go up to a less, which is a 20 microgram ethinyl estradiol. And this has a levonorgestrel progestin to it. And this progestin is similarly a little bit more androgenic, less likely to impact your sex hormone binding globulin. And then my last two very popular, Yaz and Yasmin. The reason why those are so popular is the progestin in them is drospirenone. And so it has that ability to
It's a
not
little
only
more of a
improve.
diuretic.
Exactly. It acts as a diuretic. When we think about ethinyl estradiol, and if I could just sort of step out of professionalism for a moment and ask my father-in-law to tune in because he's a nephrologist, and he would be so excited to hear that I'm going to talk about angiotensinogen, which is in the kidneys. Ethynyl estradiol goes to the kidneys, and some 17-beta estradiol goes to the kidneys and causes sodium retention, water retention. So when we think about estrogen and how it impacts our bodies, our PMS, our breasts feeling heavy and painful, bloating, slight weight gain, this is estrogen effects. And drospirenone, being a derivative of spironolactone, can have a mitigating or a diuretic blunting effect on that water retention.